Okay, everyone. Inshallah, we're going to make a start. So, Assalamu alaikum. My name is Zara Mohammed, and I am the Assistant Secretary General of the Muslim Council of Britain. Thank you so much for joining us this Sunday morning for the first installment of our training webinars. Now, we appreciate that there is a lot going on right now with the easing of mosques and reopening, and definitely a lot of pressure on our committees and respective, and also us as the general public and members. Everybody wants to know what's going on and what to do. But particularly if you are in charge of the mosque or part of that administration, it's really quite critical to make sure we get things right and we do our best. So I'm just going to pass it to Brother Wajid, who's going to begin our session with some Quran, inshallah, and then we'll make a start to the session.
جزاك الله خيرا. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. ومكروا ومكر الله والله خير الماكرين. Allah subhanahu wa ta'ala says in the Quran, and they planned and Allah also planned, and Allah is the best of planners. This ayah in the Quran usually is used to explain about how the evil people plotted and planned, and how Allah subhanahu wa ta'ala also plotted and planned to foil the plots of the evildoers. But there is also something else that we can take from this. That Allah subhanahu wa ta'ala for himself takes on board a role which is the best of planners. This is one of the ways that Allah subhanahu wa ta'ala describes himself. He has a plan. He doesn't let just things happen due to random chaos or without any foresight or thinking. Allah subhanahu wa ta'ala has a plan for everything, and he has set that plan in motion whether we know it or we don't. So it is even more important that us as a Muslim community are people who try to plan, who try to organize, who try to set things in motion in a way that is the best for our communities, the best for our deen and dunya and akhirah. In that vein, we have organized this training session for mosque COVID safety officers, mosque committees and marshals, so that they can take on board the information that has been already put out by so many sources. MashaAllah, there's a huge amount of information out there. Many masajid, many countries have put together their own documents. And this is the primary document put together by the Muslim Council of Britain, 9 steps to reopening mosques safely. This training session is going to complement that, inshallah. If you haven't already got it, please download it. You can go to the MCB website, which has the document itself, plus many downloadable signs and appendices and documents and posters, or you can just go to the short link bit.ly/mosque reopening. I'll pass back to Zara.
Yeah, thank you so much, Brother Wajid. A great introduction. Hopefully today we're going to be able to take some very complicated matters but present them to you in a way that is effective and engaging. So remember that you can ask questions in the chat box. So please do, at any point, if you do have any questions, do put them down. We are going to have a dedicated Q&A session. I would obviously ask everybody to remain muted unless you're a speaker today. We'll be covering some various topics such as medical, fundraising, health and safety, legal and logistics. What's really important is obviously we have given our guidance, but for that guidance to be effective, it's important to have these discussions, and it's an ongoing conversation. This is one of several trainings, and we will be repeating this training on Wednesday evening as well, and you can find more information on our website. I'm now going to move on to introduce our first speaker, Dr. Munazza Vohra from the British Islamic Medical Association, to give us some key medical advice at this time. So Dr. Munazza, are you with us?
If Dr. Munazza isn't here, then I'll take over.
Yes, assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah khair. Great to hear from you.
I was struggling to connect initially, sorry about that. So Jazakallah khair for the introduction. I'm talking on behalf of the British Islamic Medical Association today, and like Brother Wajid mentioned, we are complementing the guidance, the comprehensive guidance that the MCB have released. So a few of the things that we're going to be covering today, and it is going to be an overview, a quick overview, so feel free to ask questions like the sister said. The areas that I will be talking about are who should be who should not be attending the masjid to start with, and what kind of screening we should be doing at the entrance of the mosques. After that, we'll be discussing infection control measures that we can do to take all the precautions possible in the mosque itself. I know as much as possible, obviously we talk about Qadar Allah and planning, and we're doing everything in our power to not let the infection even enter our mosque, but of course we need to take the measures that are available to us, and then we'll be talking about what to do if an attendee does have the symptoms of COVID-19. So firstly, if we talk about who should not attend the mosque, I'll be referring to Appendix 6 here, which is towards the end of the MCB document. And just to summarize a little bit, I'm sure most of you have already looked at it, and it lists in detail things that we should be considering. But just as a summary, we talk about age as being a factor. So anyone who's 70 years old and over shouldn't be coming in. That's our recommendation, and that's the World Health Organization recommendation as well. But to just mention that point specifically, we already know, and I'm sure most of you have already read reports in the news about Black and minority ethnics being a higher group, a higher risk group, that are those people who are seriously affected by this illness. And there are a lot of studies going on at the moment, a lot of reports, and you'll see it a lot in the general media. Reports from hospital data, reports from the community showing that actually those who are Black and Asian, and particularly we talk about South Asians because that makes the majority of the data in the UK, we as a community, which if we look at our masajid, we are generally made up of ethnic minorities, we have the most risk of being hospitalized by this illness, and in turn having serious implications and also from dying from this illness compared to our white colleagues, our white counterparts. So the white population in itself have got lower risks compared to us. So we do have to take more steps to try and do everything in our power to protect our community, who is already a vulnerable group. So even within the World Health Organization data and their documents, some of the vulnerable groups mentioned include those who are actually 60 years old and over. So I would urge the masajid, just on that point alone, to have a think about this number and do your risk assessments for your mosque, which I'm sure my colleagues will talk about later anyway. But have a think carefully about the number 70, because I know a lot of our congregation are the elderly population as well, and Allahumma barik, the mosque is their second home. But in terms of protecting our vulnerable, I would urge you to consider reducing that number, and 60 as a minimum, I would say, is something that you might want to consider, at least for now, while the illness is still spreading and still present in our communities. And before we open up our doors fully and properly, we may need to reduce the number even more than that. So right now we're talking about, from a government point of view, 70 years old, but for our community, it is something that we would think about reducing even more. Secondly, we mentioned people who have health problems. So in the document, we've listed different illnesses. So things like lung problems already, any illness that makes your immune system low. So usually a person might already know this. So if you were to ask them this question at the door, they may be able to already give you that answer. We are, obviously there's a trust element here. We ask them a question, we expect them to be honest about these things. But anybody who has health problems, they're at risk of becoming seriously ill with this illness, and also being carriers and spreading it to the rest of the congregation. As well as that, anybody who has COVID symptoms should not be attending. So that includes fever, dry cough, all the ones that we're familiar with. And on top of that, we're talking about frontline staff, so healthcare workers, people who come in contact day to day with COVID symptom or COVID patients shouldn't be coming in. It's less about them being at risk, but more that they are likely to be carriers. So in order to protect the majority of our congregation, we would respectfully ask all frontline staff to pray at home in current times. And on top of that, we're obviously with the setup that we're going to have in the mosque, we need people to be strictly following the rules that are set in place. So there will be safety officers like yourselves, marshals, who will be guiding people and asking people to follow instructions. So we need people there who are able to follow instructions properly, so children who are very young, who will not be able to do this and are at risk of running around during congregation prayers, shouldn't be attending as well. So when we talk about screening at the entrance, this is this can be quite a daunting prospect. I imagine, you know, Barakallahu feekum to all of you. I should have started with this really, but honestly, from myself, from my family, from all the men in my family who are going to be greatly benefiting from you taking all of these measures to open up our mosque in such a efficient and in a safe manner. I know it's going to be an emotional day when the mosque open fully, and honestly, we really appreciate it. The screening element at the door, we've broken it down into just 5 steps, because we know that it can be very daunting to have a queue of people who are anxiously trying to make it to Jamaat prayer. And to simplify it, as you can see on the screen, what we'll be talking about is we just want to find out who are the people at risk who shouldn't be coming, so then you can ask them to politely go home, and the people who are coming in, just make sure that they're safe. So things to make somebody safe in a COVID group setting, we need to make sure that people have masks on, because we know that COVID is spread through droplets. So coughing, sneezing, even breathing, you can spread it. So they need to all have masks, hand hygiene, and also asking them simple questions. We've mentioned temperature here. Temperature by itself is not actually the most useful guide in screening for COVID, but fever is one of the symptoms. So if you have access to a contactless thermometer and are able to check temperature at the door, it can be useful as a screening tool. But in terms of limiting I don't want to put extra burden on you either. It also helps from a crowd control point of view. If you think about the people queuing up at the door, they want to also feel safe when they're coming into the mosque. And if they know that there's a system in place that they are going to be checked on these matters, they're more likely to comply and feel like things are happening in a with good authority and with good procedure. So temperature is a tool that we've mentioned, and is at your own discretion. If you have the facility to do so, it would be useful to do it. And then we talk about bringing your own prayer mat. So this is, each mosque is going to have their own way of hygiene, of controlling the spread of infection. So you may be asking your congregation to bring mats in. Some mosques, I know, some masajid are using plastic sheets and cleaning and disposing of them in between, and actually they're assessing it themselves and deciding that actually prayer mats might not be the best method for them. In our pro forma, we've mentioned prayer mats because generally speaking, it's easier to tell people to bring their own masala. And it's very important that people know that there will not be any wudu facilities in that open. There won't be any toilets usage for the general public. There won't be any wudu areas open, because these we know will be areas where infections can spread. Just as we're going to be, or you are all going to be limiting how people enter and exit the mosque, making sure that they are leaving with social distancing measures. So you have gaps between people. At the moment, that's 2-meter gaps. So we're making sure people are queuing in an orderly way. You're making sure people are exiting without crowding the entrances. Similarly, we can't take the risk of having wudu areas open, and even a lot of masajid are closing their shoe areas, because we know traditionally these are where everybody will congregate. And I'm sorry, I'm actually getting a lot of feedback, by the way, so I'm very sorry if you can't hear me properly, but I'll just continue anyway. Next, we're going to talk about infection control. On this slide, there are a lot of visuals here. So you can see anyway, some of these are very much common sense. Some of these you may not have considered. The main principle in infection control when it comes to COVID-19 or any infectious illness anyway, is that we want to try and limit all the areas where people are touching. We know that these illnesses are spread by droplets in the air, but also the droplets can stay on surfaces, and they can stay on surfaces for a number of days even. So we want to make sure that we're making sure that all of the areas, all the surfaces in the masajid are clean every time they've been used, touched by anybody, whether it's the congregation or whether it's the mosque staff or volunteers. So you can see in one of the pictures, for example, somebody is spraying the door handle. So these are potentially areas that we might not consider, but if you imagine, if you have multiple people touching door handles throughout the day, even if one of those happen to have COVID droplets on their hands and touch the handle, there is the risk that the next person touching it is having it and taking it home with them, or it's spreading through the congregation. So these are just measures that we need to be aware of. Again, I know it can be quite daunting having to think about all of these different factors. So just try and think of it as anywhere that is touched needs to be clean, rather than me giving you a comprehensive list of all of the surfaces. So we already know places like the floor and handles and taps, anything that is being touched has to be cleaned. Social distancing is a big thing that we've been talking about, that we've been practicing in our communities for months now. At the moment, we all know that the rule is 2 meters. So we are going to have, logistically, my colleagues will talk about that a bit later on, you're going to make sure that everybody is praying with 2 meter gaps between them. And it is essential that this is followed, as well as the hand hygiene stations, as well as preventing droplets. There's no point really if everybody is still congregating. They may feel that sense of reassurance wearing masks and feeling like they can still come close to each other. That's not the case. We know that there's evidence to say that actually more than 1 meter apart, so that's why we have the number 2 meters, is actually efficient in dramatically reducing the spread of illness. And this is a bit more detail, this slide. So it says, we're talking about what to do if an attendee has COVID-19 symptoms. You will have discussed with your team at the mosque prior to the opening. You'll have most likely a pro forma in place already. So something that you can activate if you think that somebody in your surrounding in the mosque itself has got COVID symptoms. And again, they're the same symptoms that we mentioned previously: fever, cough, just generally feeling unwell. And there are a number of people that you can notify. You'll obviously notify your imam, your committee. You will have to take measures to close off the area. It's all about kind of damage limitation here. We know that even in the community, if you feel like you've come in contact with somebody with COVID, you have to self-isolate. So of course, in the mosque setting, we have to be more stringent in enforcing these rules. So we'd have to try and contact the people who've been in contact with that the person who's unwell. The person who's unwell. Yeah.
I'm so sorry. We're going to have to just wrap up there, just due to time. But we do have a dedicated Q&A session, if that would be okay.
Yeah, no problem. So just so you know, all the information is on the slide anyway. But yeah, we'll talk about that in the Q&A section, inshallah.
Yeah, no, thank you so much. And there's lots of points in the chat. We will be coming back to this, to those questions. Dr. Manazza is going to be with us for the remaining part of this session as well. So I'm now just going to hand it over to our next speaker, Brother Adil Chowdhury from LaunchGood, to give us some fundraising top tips.
Yeah, wa alaikum salam, Jazakallah khair, as Sister Zara, and also thank you to our previous speaker as well. So my name is Adil, and I work with LaunchGood, which is a Muslim crowdfunding platform, and my piece will be split into 2 sections. Before I talk about online options for fundraising and moving digital, there are just a few quick points I'll mention about on-site fundraising, as I know that is a staple in many masajid around the country. And so if you are intending to do a physical collection or a bucket collection during your after your congregational prayers or at Jummah, every Friday, there are some suggestions that I believe that you should bear in mind with you and discuss with your committees in order to mitigate the risk of spreading any infection. So one of those is to explore contactless options. I know there are a number of masajid in London that do contactless payments as a donation form instead of a physical bucket. That's something that you might want to explore, as well as using or solely using a stationary donation box. So maybe a box at the entrance or somewhere clear for members of your congregation to go in and put their money, rather than something that's passed around between lots and lots of people, as any one of those people could have the infection and put others at risk. If you do have volunteers, however, passing a bucket round or a cloth, you could explore options for providing PPE to those volunteers, as well as spraying any antibacterial disinfectant on the cash or coins collected. And another piece of advice is, if you are collecting money physically, then to perhaps wait 72 hours before counting the donations. That's usually done manually, and you'd want to minimize the risk of COVID remaining on the coins or notes during that period. So these are some suggestions or areas to explore if you do on-site fundraising. However, the main part of my piece here is to talk about why masajid should go digital. What do I mean by that? I mean having an online presence as well as an online fundraising mechanism. We all know, and I'm sure every masjid has had challenges during COVID, coronavirus and quarantine, where your regular Jummah income has ceased, or you would have faced a number of fundraising challenges during Ramadan, which for many masajid is the busiest time for fundraising, where most of the money is made for the day-to-day running as well as any expansion projects. So some of the reasons why we should go online as masajid is that you have direct access to your community outside of congregational prayers. Traditionally, you only see your congregation during the 5 daily salawat, but also on Jummah. Now, up to this point, none of that has happened. And as you start to reopen your mosques, you won't be seeing the same numbers of attendance that you would have previously been used to. However, if you are online, then everybody has access to your fundraising mechanism just in their pockets with their mobile phone. And aside from that, you can also reach donors that are beyond your community. So people in other cities or in other countries even might be directed to your fundraiser and could support you from afar. A little bit about LaunchGood, which is a mechanism for your fundraising, or a platform, is that it's a Muslim-led crowdfunding site designed to uplift Muslim communities and community institutions. So it's really designed for masajid and charities and community projects, especially during coronavirus, and there are a lot of support mechanisms on offer. One thing that I would like to say is that this Ramadan was a challenge across the board in the sector, but we noticed a huge increase in online activity and online donations. So just along on our website, before Ramadan, we had 500,000 users, people who had donated on our site. By the end of Ramadan, we've gone above that to, I think, about 800,000 users that are donating online. So that's an increase of 300,000 new people that are donating online. And so you could be tapping into that audience and also directing your community to be part of this trend to go digital. And LaunchGood, along with the MCB and with the support of various charities such as Penny Appeal and Mercy Mission, have been able to launch Support Our Mosques. Now, Support Our Mosques is a specific initiative run by LaunchGood, where masajid can register and sign up on supportourmosque.com. You'll have your fundraising page made for you, and you'll be emailed all of your details. and advice on how to receive any funds raised, but also what we've been doing, and we've been doing this since before Ramadan. We've been providing regular coaching, training sessions on a one-to-one basis, as well as webinars like this, where we've been sharing tips on how to attract volunteers, how to raise your first £2,000, and various techniques to improve or boost your online fundraising. And this support and this coaching, this training is expected to continue for the coming months. And there is a very specific program that has recently been launched known as Jum'ah Grants. Now, as I mentioned, we've been supported by a number of charities such as Penny Appeal and Mercy Mission, and we've been able to allocate some funds such that every Friday on a Jum'ah, there's the opportunity for any participating masjid to win a grant of up to £1,000 per week. And these grants are based on how many individual supporters you can attract to donate to your masjid. Regardless of how much they pay, it's more about how many people donate to your cause. And the idea is to support smaller masajid. So while any masjid can take part and support our mosques and access to training and the webinars and have the one-to-one calls, this Jum'ah grant, this Jum'ah grant is available only to masajid that have a turnover of less than £250,000 per year. And as I mentioned, it's supported by various charities, and there is a fund that individuals can donate to where we can use those funds to disperse as grants. So how do you get involved with Jum'ah grants? It's very, very simple. All you have to do is go on supportourmosques.com and register there. And even if you're a masjid that raises more than £250,000 a year, please visit the website and register anyway, so you can join this collective effort and you can take advantage of the coaching and training on offer. It's very, very important. Alhamdulillah, during Ramadan, we've had some fantastic success stories. I believe we've had some masajid that have told us that purely through their online fundraising efforts, they've raised more money than they would have during a normal Ramadan, where there was no quarantine and they'd have their regular Jum'ahs and congregational prayers. So please do explore this online option, and we are here to help you. So you have supportourmosques.com, or if you have any specific questions that might not be covered in the Q&A, you can always email me at adel@launchgood.com. So that's everything from myself. I'll pass it over back to our host. So jazakumullah khairan. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you so much, Brother Adel. And again, another fantastic initiative by Launch Good, and a really great way for mosques to galvanize funds and inshallah re-inject a little bit of finance back into the masjid in preparation for reopening. So I'm now going to bring our next guest speaker on, Brother Shoaib Maya, who is a health and safety expert and is working with many mosques, especially in the northwestern Wales, to talk about health and safety. Okay, I'll pass it over to you, Brother Shoaib. Assalamu alaikum.
Assalamu alaikum. Thank you for attending today. Inshallah, it's already been of some benefit. I'll start with the first slide, and we're looking at the risk assessment itself. Risk assessment is a legal document. It's brought a lot of fear, I think, into some of the masjids that I've spoken to. It's nothing to fear. It's more an analysis of the negative impacts and events it possibly may have on the individuals attending the masjid and those who are part of the masjid. That being said, this risk assessment is COVID-19 specific. Being COVID-19 specific, there's certain due diligence that needs to be put in place, and also, like I've said earlier, an analysis of the potential negative impacts that the COVID-19 virus will have on the masjid. The best way to obviously look at the risk assessment is to see that, yes, it is a legal document. It does need to be signed. It does need to be adhered to. The responsibility does fall on the committee members and the trustees. So by ensuring that it is full, thorough and comprehensive, and covering all aspects of the masjid, we can then see that if there is any complaints or issues that we are needing to address, that we have covered them in this document. There's certain aspects of the document that we need to look at, and that is the hazards identification and the risks that come of the hazards. As you can see in this slide, it's obviously the hazard control and the control measures that we do put in place. I'll let you have a quick read of the slide, but I will mention that we have to make this a very realistic and practical approach. There have been some comments in the chat already for some suggestions. The only thing I would say is make it realistic and feasible. Look at the mosque masjid budget. There are certain aspects that you will find in the risk assessment, and there will be some very innovative answers and control measures that can come of them. Going back to being realistic again, plastic coverings come at an expense, they're not cheap. What alternatives can we have for plastic coverings? There are also not just the tangible, the physical aspects of control measures that we need to think about, such as hand wash, social distancing, tape, posters. There are also other control measures that need to be taken into consideration when looking at control measures, and those are items such as time. We don't necessarily think of time as a control measure, but I think it's one important one to consider if you are putting together the risk assessment at the minute. An example would be the khutbah. Shortening the khutbah, Jummah, would assist you in obviously providing the service of giving the khutbah as is required at Jummah. Having a shorter khutbah would assist you in the cleaning in between the Jummahs, the Jamaat, sorry, and the amount of attendees. Say, for example, a masjid needs to hold 3 Jum'ahs to cover the total full capacity pre-COVID conditions. Then you have to consider such aspects as the entrance, taking shoes off, those brothers putting the shoes into the bags. That takes time as well. Finding and opening the prayer mats, and at the end of obviously the Jummah, putting the prayer mats away, opening the shoes from the bags and putting the shoes on. That also takes time. After that, we also need to close the doors, and we need to also have the cleaning put in place. So cleaning touch points that we've already talked about, looking at cleaning aspects of floors, walls, depending on what the situation is, the surfaces, all that takes time. So time is probably an example I'd like to give there. Other ones such as communication and welfare. Welfare comes under control measures because it's a legal requirement. Some masjids are closing toilet and wudu facilities. However, we have to differentiate that toilet facilities, provision of them is a legal requirement, so providing just probably a disabled access toilet for those staff members and volunteers that are on site, that kind of thing. Also, control measures would come into play with ghusl facilities, stairs. Not all masjids have stairs, not all masjids have ghusl facilities. Those are called site-specific hazards and controls that you will need to look at. Going on to the next slide then, we've talked a lot about it already, the resources. The funds that masjids have at the minute, we have spoken about grants and all the potential budgets that masjids can have. Don't forget that COVID is not a permanent situation, it's a semi-permanent. There are talks of the actual social distancing being reduced, so to speak, next week. The guidelines to change. It's not official, but I think it will be discussed next week for the hospitality industries. That being said, they can't pick and choose which industries imply or have the 2 meter and which have the 1 meter. I think it will be a blanket rule. The reason I picked up on that is because the resources that you are then going to purchase, provide, you need to take these aspects into consideration, because it's not a permanent fixture, the COVID-19. It is shifting. rules are being relaxed, and at the same time it can go the opposite way, where we have a more going to phase 2 possibly, where rules and restrictions will come back in force and lockdown will then increase instead of being relaxed. So just bear that in mind when looking at purchasing your resources. If the masjid is to close because we have an increase in COVID symptoms in the UK, then you're going to have 500, 600, 1,000, whatever you've ordered, antibacterial hand washes, gone to not to waste, but just sitting there waiting for the reopening. So just be careful on your purchasing. The main thing is, I think, the training, resources, don't forget, include your staff and volunteers. I put the investment into them, and I put the investment into the communication with the community, and I put the investment into the moral responsibilities you have. So, for example, ensuring brothers and sisters outside the masjid are attending at 2 meters, not disturbing the local residents, minimizing any potential threat of complaints. That kind of investment needs to be made at the minute, and then look at any monetary investments that you need to make. The next slide is review and update. I won't dwell on this one. It's more a case of, we've already talked about the government guidelines changing, but more locally, if you have volunteers that you are recruiting that have specific requirements such as wheelchair access, dietary conditions that they need to eat at regular times, medication, maybe we need to readjust the risk assessment to include those. That's where the review comes up into it. The update would be as time goes on, say for example in 2 weeks, we should have a review of the risk assessment, get some feedback from the community, perhaps get some feedback from the committee members, more importantly get some feedback from the volunteers. Maybe we don't have a strong stance on crowd control. That can be reviewed in 2 weeks' time, the risk assessment looked at, the way that the setup of the masjid looked at, and then we can go back into having a look at updating the risk assessment again. There again, investment, keep it very low. I would invest in resources such as communication, resources such as your volunteers and staff, and the community communication, posters, signs, banners, cleaning products, those kind of things are already a part of the masjid anyway. Extra additional resources can be reviewed and updated dependent on, say for example, government guidelines changing, adjustments to the location of furniture in the masjid. Say we need to increase the prayer hall and we have too much furniture in there. Where are we going to store that furniture? Where are we going to locate the one-way systems, bearing in mind fire exits? If we're blocking fire exit, that needs a review and update. All these things need to be considered. The last point would be appointing duties to COVID officers and marshals. MCB have made it very clear that if we have a member of the community who is responsible, who is part of the community, and everybody has a good understanding of and respect. When I say understanding of, I don't just mean the linguistics, so multilingual, able to communicate with the community, but also be able to speak to the community on a level. We have been speaking about those attendees who are pillars of society. We can't exclude those because they are of a certain age, but unfortunately, due to guidelines, they may fall into the vulnerable categories outlined by government guidelines. If we do have those pillars of the society of community who are attending the masjid and they show signs of COVID, we need to empower the volunteers to be able to respectfully ask those attendees to come to a side, either take the temperature or ask them to self-isolate, and then obviously communicate with the rest of the community or the actual attendees in that particular salah to say, brothers and sisters, unfortunately we have found potential symptoms, obviously not confirmed, please leave the masjid. That kind of voice needs to be given to somebody of authority in the masjid.
I'm just sorry, in the interest of time,
No,
we're
it's
gonna
fine. No,
we're gonna have to wrap up, but we do have a dedicated Q&A. Thank you so much for covering all those really important points. We're just gonna need to move on to legal training, so we'll come back inshallah to you. Thank you so much. I'm now going to introduce Sister Ifat Nawaz. She is the chair of the MCB Legal Affairs Committee and a member of the Muslim Lawyers Action Group. And she's going to be talking about taking responsibility, the key kind of key legal responsibilities that you'll need to consider at this time. Assalamu alaikum, Sister Ifat.
Walaikum salam. Assalamu alaikum, everyone. Can you hear me?
Yep, nice and clear. Thank you.
The objective of this short presentation is to really provide some pointers for those with the legal responsibility of running the mosque as to some of the steps that they should be taking to follow the government guidance and to protect themselves, the organization, and their members if and when a decision is taken to reopen the mosque. So I'm going to be very briefly talking about legal responsibility, about some of the practical steps, and I apologize in advance because there is some overlap between the 3-4 speakers, and I'll try and be brief on this point. And then I want to focus on decision making and reviews, which I think are going to be quite critical. So who is legally responsible for ensuring the safety of the mosque staff, members, volunteers, and visitors? Well, essentially, the trustees, the management committee have legal responsibility, and it's upon them to comply with the guidance that's being provided and to ensure that this is followed by the members of your congregation, because if there is a failure to do that, any legal action that comes out of that will be against the organization and potentially even personally on the trustees and members of the management committee. So it's really important to take the precautionary steps and to ensure that the members of your congregation comply with the measures you're trying to put in place, and to have a good communication strategy so they understand the implications of failing to do so. If we go on to the next slide, please. So the practical steps, I mean, you've heard this morning already about putting these measures in place. So we would advise you to seek assistance, speak to the local authority community engagement officers who are very active at the moment at supporting their local organizations as much as they can. See what information you can get from them, what funds are available. Also consult legal, medical, and Islamic scholarly advice where you have to. And then appointing your COVID-19 officer in relation to the person that you allocate with this responsibility. It's important that this person is familiar with the government guidance and other guidance that is out there, and is able to communicate with all the parties. So that's really important. It's also important to ensure that you're complying with any insurance policy requirements that you have. So checking that should be done in advance as well. And then preparing the necessary policies that are arising out of the action that you're taking. So maybe you need to prepare some new policies on how staff have to deal with, anger management. I know one of the questions on the side is about people getting angry and aggressive. You will need to have policies in place on how to deal with this, and staff will need to be trained about this. You may need to have a policy on incidents and how are you going to handle those. There's been a lot of talk already on risk assessment that needs to be undertaken, and measures that you're going to be putting in place in relation to that. What we would say is that with the responsibilities of the COVID-19 officer, that whilst they conduct a comprehensive risk assessment of the entire mosque, they should prepare a document for the benefit of the trustees and the management committee to demonstrate the risks that have been identified, the steps that they've taken or should be taken to deal with the risk, and having done so, whether the risk remains low, medium, and high. And you should try and aim for low risk on all these counts. The risk assessment should also, we recommend, be completed at least 7 days prior to your planned reopening. And if that's not possible, then delay your reopening until, someday after 4th of July. ensure that your relevant policies are all prepared for all relevant matters, including health and safety of your staff and volunteers, cleaning and ongoing maintenance. You should also be providing training and workshops for your staff and volunteers. And this is really critical because as employers or of your staff, you will be responsible if they are exposed unnecessarily or adequate measures have not been put in place. So do bear that in mind. And then want to go on to the decision-making process. So if we can go to the next slide, please. This is where we are advising recording the due diligence that you have carried out as the trustees and management committee, calling a meeting where you sign off the risk assessment that has been undertaken. You set out the measures that have been put in place to enable the mosque to reopen. Have you considered phased reopening? There are a few mosques that have done phased reopening where they open their mosques for maybe Zohar prayer and Asr prayer and see how the community responds to that. And they are introducing their measures in that way and seeing how their staff cope. And that's working very well with the mosques that we're aware that are doing that. Also documenting the training that has been given to staff and volunteers, having a copy of that material perhaps appended to the minutes of the meeting to say what training has been given, which staff attended, and making sure that's all recorded. And also your communication strategy with the congregation, members and public and visitors as to how you're rolling out and what measures you're putting in place, what you expect from the public. A lot of what the previous speakers have spoken about should be recorded in the minutes where you are signing off that you're going to reopen the mosque. And also the necessary PPE equipment that you've put in place and that has been provided to all staff that need that. Maybe also doing a tour around the mosque and checking all the signposting that's been put up and ready. And having gone through this process, you as trustees and members of the management committee agree that you sign off all of the above and that you're going to reopen the mosque on a certain date. And these minutes should be filed appropriately to show due diligence should there be any challenges or accountability required at a future date. Can we go to the next slide, please? This is my final slide, which I think is quite important because this is all about reviewing the processes and measures that you're putting in place. I mean, I've recommended here that initially you hold review sessions between yourselves on a weekly basis. Now, this may seem very onerous and people may say that this is too much, but if you consider the impacts of things going wrong or the congregation not responding, we think it's valuable that you carry out your initial reviews, maybe in the first 2 weeks on a weekly basis to see what went well, what didn't go well, what actions need to be taken to try and address those issues. And, and you need to evaluate and implement any action that you can take. And you may also, need to ask yourself at each of these review sessions, is it safe to remain open? Or should we actually close the mosque down again? Because perhaps people are not responding the way that you wanted to, and maybe your staff are not able to manage the expectations of the community. Because ultimately, the decision and the responsibility lies with the trustees and the management committee. So this is an ongoing responsibility. So you will need to evaluate your risk assessment, the responses, the people's expectations, and you will need to, we would advise record these regularly to show that you have been carrying this out on an ongoing and continuous basis until the whole coronavirus is more manageable by everyone. So that's just a brief overview based on what previous speakers have said, and I'm happy to take questions on this. Thank you.
Thank you so much, Sister Ifat. A really brilliant and concise overview, and inshallah, I'm sure there'll be plenty of questions. For those of you who are asking, we are recording this session, and we will be circulating that recording after the session has been completed. I'm now going to hand it over to Dr. Wajid Akhtar, who's going to talk to us a little bit about some of the logistical issues and maybe just a bit more of an overview. So Brother Wajid, I'll pass it over to you now, inshallah.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you all for coming on a Sunday morning for this training, and thank you to all our speakers for sharing those insights. They've gone through a lot of information, And my job is to just bring that together and summarize it a little bit. So what have we heard so far? What you've been hearing so far are key information, top tips, things that you wouldn't necessarily get from the guidance. Alhamdulillah, there are loads of guidance out there. Every mosque, every committee, every country is producing their own guidance. Now, the first question you might ask is, how do I know which guidance to choose? There's no way of answering that question. It's each of you find one that fits your own circumstances best. You may want to choose a guidance that was produced more locally. You might want to make your own guidance, but in case you don't, because we have several thousand masajid in this country alone, and not every one of them will be able to or want to produce their own guidance. The guidance produced by the MCB, the 9-step guidance, is there as a template for you to follow. But you're free to use any guidance or risk assessment that you feel fits your mosque best. But no guidance will be able to contain all the information because it needs to be usable. So the key information that we want everyone to take away, because you are the mosque safety officers, the COVID safety officers, right? This is a job that didn't exist a few months ago. And now it's one of the key jobs in the Muslim community, a voluntary job. For the mosque committees, for the mosque, the marshals and the volunteers, what is the key information that we want you to take away? So from the medical side, as you heard from Dr. Munazza, that it is about infection control. It is about watching out for those touch points. If you can make sure that anyone coming into your mosque has a face covering, is avoiding touch points, and is keeping that distance apart, you're doing well. What did we hear from Brother Adil from Launch Good? Every mosque is complaining about the financial instability, but there are options out there. It would be lovely if the government gave us grants. It would be amazing if they did that, but they're not likely to do so. They'll give grants to lots of businesses and restaurants and so on and so forth, but they're not likely to give it to places of worship for a variety of reasons. So let's help ourselves. Let's get onto the Support Our Mosques platform. Many mosques have helped themselves. More than 400,000, nearly £500,000 raised for masajid by themselves, and in doing so, strengthening their networks and their community. Let's use that opportunity, inshallah. We had Brother Shuaib talking about health and safety, about how it's so important to think things through in terms of your resources and time. It's not good enough to start the surgery and then say, I'll work out if I have enough people to help me with the surgery or I have enough equipment for the surgery halfway through. No. So don't open the mosque and then work out if you have enough volunteers or enough time or enough resources. Do that beforehand and then open accordingly. So even if your mosque has 3 floors, but you only have volunteers to manage 1 floor, then only open 1 floor. It sounds logical, but that's what our health and safety team are advising. Go according to your risk. And of course, there was much more information there. And then legally, Sister Ifat was explaining to us about who the responsibility lies with. And what is that saying? That's saying that if the responsibility lies with you, then you should be the one who should be comfortable with the decision that's taken. Even if the community is pushing you to go further than you are comfortable to go with, they're not going to be standing next to you in the court. It's going to be yourself, Nauzubillah. So make sure that when you take a decision, that the people who are legally responsible are the ones who are comfortable with the decisions being taken. So there are, if you want to educate your volunteers, there's a repeat of this session on Wednesday. I would recommend every mosque to please tell your COVID safety officers and volunteers who are not in this call to come to the next one. I know you can have the recording, but let's be honest, most people don't listen to recordings, especially not 1 hour long recordings. Tell them to come to the session and tell them that's part of their training. Also, the question that people are asking, what about my community? They're going to be angry, they're going to be upset, etc. That's true. Some of them may be. Tell them to come to training for community members. We have specific training for community members on Sunday the 28th and Wednesday the 1st. Tell your community, guys, this is training for you. Come to these sessions, inshallah, and find out what you need to do for the masajid. Let us tell them how to exist in the new normal with the mosques. I'll finish there. With dealing with complaints, it's important to deal with complaints is to practice ahead. If you have done your planning and your preparation, inshallah, you will minimize the complaints. But the other thing that you should do, get your community on board. Don't dictate to your community. If MCB had come to the mosques and say, guys, you will do 9 steps and you must do X and you must do Y and you must do Z, every mosque in the country will tell them that you must get lost, right? We don't have anything to do with you. But if they did the way they did it, they had a survey with more than 300 mosques and community leaders. Then they had webinars. Then they had regional webinars. Then they had one in Scotland. MCW, MCS, everyone was coming together. It really felt like this is a collaborative process. The 9-step guideline is not made by some, boffin in the sky. It was made by a combination of advice from most masajid and committees and scholars and medical experts and legal experts. Everyone came together to put this together. So everyone feels invested in it and they want to make it work. So for your mosque, don't dictate to your community, involve your community. You still have 2 weeks now. Organize a webinar, get a survey, speak to them, ask them what do they think, get their opinions, and then give what your advice is from your own side and also the advice from the national level which we're giving you, and share these things. Because then, even if someone disagrees, they will feel like they were involved in the discussion. This is the advice that we have. Logistics, there are 101 things that you will find out afterwards, but let's prepare beforehand and get our community on board and on site, inshallah. So those are the important points. And there are many areas that still to this, people will have questions for. So if you do have any questions, please put it in the chat box, inshallah, so that we can go through them. Well, Jazakallah khair. I'll hand back to Sister Zara. There are a few questions there.
That's fine, inshallah. Thank you so much, Brother Wajid. And I think a really important point that you just made, and I think also we should remember it's a time to be compassionate, and just remember that obviously everybody has a good intention in coming back to the mosque and wanting to be reconnected spiritually. So just keeping that in mind when we are dealing with maybe some not very pleasant situations. There's quite a lot of questions, but I'm going to group them together and maybe just kind of direct them at different speakers. I think there's a lot around, what is the right risk assessment, and what do we do about non-compliance, and also regarding insurance. I think Brother Shaib, it maybe would be quite good for you to kind of respond to some of those points, just briefly.
Assalamu alaikum again. Just quickly then, the actual risk assessment itself, like Brother Wajid has said, there's no actual correct and proper risk assessment. The best thing you can do is look at your site. There are a few templates on the website if you can have a quick look. There are some comprehensive ones, there are some that give you the headings. I would suggest that my only concern is that health and safety in general should be in place pre-COVID with the masjids. Just ensure when you do look at your risk assessment, you're taking into account all aspects of health safety, such as fire, first aid, crowd control, that kind of thing. In terms of compliance, compliance is quite a critical thing. As long as you look at the risk assessment, you've taken your due diligence, you look at the legal responsibilities and moral responsibilities. Inshallah, I won't dwell on that too much, but more questions and answers from that topic itself, I'm sure, are in the community. So at the minute, I think it's just a case of there's no right answer for that. I think the right answer, the best answer would be look at your masjid and literally walk around the masjid physically, speak to the community. Jazakallah.
Thank you so much. I guess there's a question around if social distancing rules change to 1 meter, should we go for it? I think Dr. Manaza might be quite good for you to kind of answer that one.
Yeah, Assalamu alaikum. A lot of, the guidance that we're giving at the moment, obviously we're not trying to overburden our masajid or overburden you all, the committee, the people who are enforcing these rules. If we do know that there is evidence that actually, yes, rates are reduced, rates of infecting people are reduced but with 1 meter, and they're reduced even more so with 2 meters. So we're going, obviously at the moment, the rules are 2 meters, so we follow that. If you wanted, it would be at the mosque's own discretion. I can say that 2 meters is safer, but 1 meter is better than no social distancing. So I would say, really, you know, following, it would still be in line with guidance from the government and with medical guidance to say 1 meter is better than nothing. So as long as you have some measure of social distancing in place, that will still help to lower the risks of infection.
If I could jump in there, the key issue as well with the 1 meter thing is that the reason 1 meter is being done is not for medical reasons, it's done for financial reasons. Because in the restaurants and the pubs, if you have 1 meter social distancing, you can have up to 50% of the occupancy. But with 2 meter social distancing, you're probably getting a 25% occupancy. Now, the mosques are indoors, not outdoors, number one. Number two, the mosques have the highest risk population, Black and ethnic minorities. Number three, the mosques are not 1 or 2 minute interaction. It's 10, 15 minute interaction before, during, and after prayer. So there are a number of factors that we need to think about. Let me put it this way. At 2 meters, the risk of catching coronavirus is half or less than half at 1 meter. So this is something to think about, inshallah. We cannot, if the government says 1 meter, then, you know, we're not going to say that you have to go to 2 meters. We can't enforce anything. But if you want to be extra safe, 2 meter is extra safe.
Yeah, thank you, Wajid. I think all of this guidance and advice is really for you to decide what is the best and optimum way of keeping everybody safe. And I guess the reality of what the mosque situation actually is. Just got a question for Sister Ifit regarding mosque insurance providers or brokers who are aware of the COVID spectrum and mosque reopening. Unless they specify exclusions, surely are covered to the contrary. So I guess maybe just how to manage that. Mm-hmm.
Yeah, I mean, what we've said in our advice is that you should check your insurance documents and make sure that there are no onerous requirements on you. So it's worth for the right officer or trustee to go through the insurance policy and just make sure that you're not doing anything that would negate any claims against you. We've debated this internally, and we don't think you need to do any more than that, but just let them know that you're going to be reopening the mosque and let them know of the date. Standard insurance policy should cover these kind of scenarios, but we are in uncharted territory, so it's always worth checking everything before you embark on anything further.
Yeah, that's great, thank you. And just for Dr. Wajid, just some points on regarding sisters, also the kind of inclusion of sisters in reopening, and also the use of an emergency toilet facility if needed. Should that be made available?
Jazakallah khairan. So the emergency toilet facility, I believe Brother Shoaib will correct me, but I think you need to have at least one emergency toilet facility available. But this isn't something that everyone can use and abuse. It's there for emergency. So that's the ideal over there, inshallah. Number two, on the sisters, opening for sisters, there's two sides of this. There's the fiqh side of it, and different people have different opinions on the necessity of sisters of going to the mosque, especially when there's less space available overall. But there's the other side that it's really important for the mosques to consider, and that is that the whole pandemic has been very, very difficult for everyone, has been extremely difficult, but everyone includes our sisters. So just as we are worried about those people who are saying that, look, it's difficult for you to come to the mosque because you are at high risk, it's also, we have to think about what about 50% of the Muslim population. It's to say it's difficult for you to come to the mosque because we don't have the space for you. We have to think about what does that have an impact on their mental health. We also have to think about what impact that will have for the mosque in terms of social justice and equalities commission. There have been reports of groups being set up trying to identify which mosques are not going to allow sisters in. So we don't want a situation where, you know, with the social justice movements of Black Lives Matter and so on being there, we don't want a situation where the mosques are lumped into a category where they're denying a section of the population. So we would advise that there is a way of finding a balance and finding a section. The majority of people are very understanding, but if you meet them part of the way, but a blanket rule would be difficult to advise. You know, to advise against.
Yeah, I'm going to pass it over to Sister Ifit, who's got her hand up, and then we'll come to you, Brother Shoaib, as well. And there's been a couple more questions, Ifit, regarding insurance. Yeah, we picked them up on rental spaces.
I have. I'm looking at the questions.
Great.
I mean, the thing is, I'm not sure how much you know, disclaimer forms are going to help. I think what's more important is focusing on discharging your responsibilities and being able to demonstrate that you've done that. So that's really key, and letting the insurance company know that you've carried out a risk assessment and that you're going to open the mosque. If they have any queries, they'll come back to you. In relation to rented premises, again, you just need to check your documentation to see who's responsible. As long as you're discharging your responsibilities, you know, you should be covered. You know, no one can do everything to eliminate the spread of coronavirus, but as long as you are taking as much precautionary steps as you can and keeping everyone informed, I think that's what the expectation is. And if you were if you were to face any challenges, as long as you can demonstrate the steps that you've taken as a management body or trustees, then you should be okay. But if you have any further queries, then you may want to contact us through the MCB admin and direct your questions at us, and we'll pick them up there.
Yeah, that's perfect. Thank you, Sister Ifit. Brother Shoaib, if I can bring you in for a couple of points that I've also received on message. Regarding, there's been a few people mentioning, you know, like a register of attendees, also any rulings around children on the age limit, on the use of shoe bags, and also on the point of first aiders. So just a few points there. Don't know if you got all of them.
Yeah, Assalamu alaikum again. So the last one was first aid. I'll run through them quickly. Inshallah, I won't keep you too long on these points. The first one being the risk assessment. Sorry, what was the first question again?
So it was regarding a register of attendees.
Yeah, that's fine.
And then the point on what should be the age limit of children, if any.
Yeah.
And shoe bags, the use of shoe bags. It's been a bit of a debate. And then just on the importance of having first aiders. Yeah.
Right. So the register of attendees, if you are planning to open on the 4th, I should stress that it's not feasible. 50% of the masjids that I've spoken to are not opening on the 4th. They are opening around the 20th to the 24th. That being, the reason being, obviously, we need all these things need to be put in place. A lot of work needs to go in, as Brother Wajid was saying. Have you got the resources? Have you got the allocation? Have you recruited enough volunteers and staff? Whatever that date may be, before that time, you should have some sort of registration for attendees for the local residents of the locality of the masjid. On that registration form, just bearing in mind GDPR as well, we won't go into that just now, but I would take some sort of health surveillance, so whether not to disclose the age or the conditions of the person, but if they are fit and well, if they're not falling into a vulnerable category, it is possible to do so. I don't think it's logistically easy to carry out any kind of registration or anything on attendance. Same with the actual temperature taking, moving forward with anything else for looking at the ages of the children, that kind of thing. Is basically trying to get everybody into the masjid, read the salah, read the jamaat, and everybody out again. The responsibilities will come with 10-year-olds. If they are basically running around, I would suggest that you pull the child respectfully to the side, or the parent to the side, and say, look, unfortunately they're not adhering to social distancing rule. That comes under behaviour aspects. So within the risk assessment, there should be an aspect of behaviour that's considered as well. Not everybody's going to bring their passport or ID card to the masjid. I don't think I do. So it's just a judgment of the individual adhering to social distancing rule, and also the masjid rules as well. The use of shoe bags, I see a few questions popping up there, a few hands being raised. I'll come back to that, Sister Zara, if that's okay. Use of shoe bags, there is mixed thought on shoe bags, because if you are bringing a bag from home, then you're potentially bringing an infected, not saying it is infected, but potentially bringing an infected bag into the masjid to be then used, so introducing the virus to the masjid. The control measure ultimately would be to provide every attendee a bag. What's the resources allocation for something like that? What's the financial impact on something like that? Every Friday you're providing, what, 500, 300 bags to every attendee. If it's possible, then do it, and then remove all the bags that have been used for that Jummah, into waste. But I think ideally, being realistic, we have to get the attendees to bring their shoe bags with them, keep it with them, and then same as the prayer mat, same as the any Quran, any tasbih that wants to be bought. It's basically the notion that what equipment you bring with you is not shared and taken back home with you. So water bottles can fall into that as well. Some masjids are offering the facility for water. I would be careful with that one, because you have congregation, the logistics of moving attendees past the water butts, the water fountains. I would just suggest, if you are interested in offering anything to the attendees, I'd first take the route of asking the attendees to bring their own equipment to then be taken back with them. Same with the volunteers and the staff. They should bring their own lunches. If not bring their own lunches, they should have some sort of provision that they can have in their own vehicles, or possibly return home in between Jamaats and Salah for their welfare and their well-being. And the last one being first aid. First aid boxes, as long as first aid boxes are up to date, there is an expiry date that not everyone realizes on some items inside the first aid box. Just have a quick look inside the first aid box itself. I'm sure most of the adults inside the masjid who attend, and staff and volunteers, can apply their own plaster, but we have the issue of those who may feel queasy, dizzy, may feel the need for assistance in applying first aid provisions. That being said, you may have to break social distancing rules. In that case, with the first aid box itself, I would admit I'd put together a first aid pack specifically for the first aid box. So gloves, mask, visor if required, an apron, so that if you do need to assist somebody with first aid, the provisions are there. Anything more than that, it's obviously a 999 call. I'm sure the medics on the group will back that answer up, or provide further information. Just one last point, Brother Wajid brought up the question about toilets. It's a welfare regulation that, as a responsibility of the management, we provide toilet facilities to volunteers, staff members, and users of the site. Because we are closing wudu facilities, I think it's best not to advertise the toilet facility being a disabled single-use toilet. Most disabled single-use toilets have small sinks in there, potentially a wudu sink. I wouldn't go advertising it. I would potentially have that facility just for volunteers and staff.
Thank you so much, Brother Shoaib. Really, really good points, actually, and a lot to consider. So I hope everybody got that. A question for Brother Adil. Does Launch Good have any specific training for mosques?
Yes, so that's a great question. So LaunchGood have got a number of webinars that we delivered live, very much like this one, and it's on our YouTube page. However, the best thing to do if you are interested in training on how to fundraise online or prepare your teams or your volunteers to fundraise online is to get in touch with us, either by emailing me, adil@launchgood.com, or going on to supportourmosques.com, putting in your details, and then one of the LaunchGood team can set up your page for you and provide access to the different training videos that we have, as well as scheduling any one-to-one training.
That's great. Thank you so much. I think we're now coming to a close for our session. There's been a couple of questions which Dr. Wajid has responded to. We will be having more training sessions as well, so you can continue asking these questions and the conversation, whether on email or at our next training session. I just want to take the opportunity now to thank everybody who's taken the time to be here, for all of our guest speakers who have provided a really extensive and comprehensive overview of some of the really critical considerations that we need to take into account. I think one of the key messages is that this is a dynamic process. Things are changing, the guidance may change, but the most important thing is, you know, we know the reality of our communities, and we know that this is a process of bringing them on board and helping to educate and giving them really easy ways to develop the good habits they need to get everybody through this process and make sure that we can go to the mosque safely. And also to remember to be inclusive in this process as well. There's a lot of different members in this community that need to also be taken into consideration that may want to come. And I think a final key message was, if we do have maybe the elderly or more vulnerable trying to come and they need to be turned away, just to be really compassionate in that process and just make sure that they understand that we do want them to be able to come to the mosque, but just not yet. And we need to just make sure everybody is kept safe. And we do our best. So thank you again, everybody. Please do check our guidance if you haven't already on the MCB website. The links have been shared on the chat. We will be continuing to host more webinars, and all of our guest speakers you can get in touch with. Again, just drop us an email, or they've given you their email address. But inshallah, we just make dua that Allah makes this easy for us, inshallah, and that grants us success on the route to reopening safely. And fundamentally, I think it's a really good network of support and communication. So if there are resources you can offer one another, please do. If you are a healthy safety officer and you're willing to do risk assessments for your local mosque, then please do. And if you have any great ideas or initiatives on how we can make this process easier, please do share as well. So from all of us, thank you so much, everybody. Take care, inshallah, and have a good Sunday and good week ahead, inshallah. Assalamu alaikum.